represent State Institute of Urology in Moscow, and the head of our institute is Professor Oleg Apolichin. Probably you know him. Part of our work is to provide urological scientific information to Russian urologists, because as I said, probably you heard that Russian language, the language problem is one of the main in Russia, because very little of urologists knows English. So it's quite difficult to get information from international society, from European society, where the official language is English. So we are translating as much as we can from abstracts and articles, and we go to conference and present the content of the conference to Russian urologists. And also this is a new format for us to make interview with opinion leaders with
I think you have brought out very good points. SIU is basically taking care of the urological diseases, and urological diseases do not have borders. They are beyond the borders. The disease can be in United States, it can be in Russia, Japan, India, in Africa. Diseases are same in a different way. Some diseases are diagnosed early, some diseases are diagnosed late, depending upon the facility available. SIU is a global organization. It has got 124 countries as a member. Now, in every country has a different, like Japan has a 130 million population and they have 8,000 urologists. While Nigeria has a 160 million population and there are less than 100 urologists. In USA and in Europe, there is a one urologist for 50,000 patients. In China, there is a one urologist for 80,000 patients. But if you take my country, India, the one urologist for 600,000 patients. So even though India has a large country, has many urologists, but the population is large. What is our aim is to spread the urological education to all the part of the world. There will be some differences of level of education, level of patient care, level of patient understanding. Our aim is to make sure that the knowledge is available to all. That's why we have a conference. I met many of my Russian friends here, and they were quite happy to see. Now, some of them were speaking good English, so they could communicate. They were interested in many, many diseases, including stone, which I'm specialized. Thing is that during this conference, you learn quite a bit. Sometimes you learn from the slides. You may not understand the accent. But what is done as SIU is this, all the plenary lectures are kept on the webcast. So when you go back, you can listen to it again. You can listen to the slide, you can see the slides. Or if you have an institute, like what you say in Russia, then a person who knows English can translate, because material is there. The slides are there. You need to only translate what he is seeing. And then he can say what is important. It is important that we have the books. We have a journal, which in China, they translated it into a Chinese language. So you can translate which is an important article. You don't have to take the whole journal, but a person can say, okay, this is an important article, let's translate it in Russia, because it's important to convey to the doctors that this is the new thoughts. Then we thought action speaks louder than your voice. You understand? I have seen Russian ballet. I don't understand Russian language. But the ballet itself, the person who's dancing expresses so that you can understand the language. And that language is universal. That, ballet. Similarly, the operation which you do, when you do the operation endoscopically or thing like that, person may not understand what is said, but he can see what is being done. And then he see the surgery and thing. And then remaining thing he can see in the books and read out. So with this view, last year we did an experiment. We conducted a 5 workshop, 4 in my institute in India, and it was webcasted. It was uploaded, and those who are SIU member could log in. And Russia was one of the country which logged in. There are so many people who from Russia who went on the internet because they had the password. They got into it. They were watching urethroplasty. They were interested in urethroplasty, so they watched the thing on the urethroplasty. We have internet analysis. There are 20 countries which logged in a good number, remaining maybe few. So we realize that importance. At our place in SIU, we conducted small workshop when 100, 200 people used to come and watch surgery. We conducted about 52 workshop in my place, and 3,900 doctors came to watch. We conducted 4 webcasting, and 18,525 people logged in. And there are more people who could watch. In Bangladesh, they connected to the projector and projected onto a screen. There were 52 people, and they could do the internet and ask question. Now, what you need in Russia, not everybody may not speak English, but there must be some who can speak English. So he can explain to the people what is happening, and if anybody has a question, they can write. So a internet or visual is a medium which you can utilize in teaching. I think this is very important. The knowledge is learned. What is important is 2: knowledge acquisition and skill training. Knowledge you can get by books, attending conference, reading this ICDU books, international consultation on urological disease. But skill training, you can go to any center. You can do the lab training. We have 28 accredited training center which has got a facility of lab training, dry lab, and then wet lab on animal or a cadaver. You can work on it. Once you get practice makes man perfect. We surgeon, we learn to tie the knot. So what happens in spare time? We have a thread. We put across and then tie the knots with both hands. You see the tennis player. He serves with one hand, then returns with this hand, goes like this. What does he do? He does practice. So anything which you want to do, a good surgeon is not born good surgeon. By practice, he's become a good. So a smooth way of doing, a belly dancing, that smoothness is there. It's like a surgery is an art. And then when you perform the art, surgery is a science. Medicine is a science. But when you apply it to the patient, it becomes an art. You just don't do the surgery. You talk to the patient. You explain to the patient. So this time we have come out about a PSA screening. There are 2 views. It should be done, it should not be done. So we come out with the paper. If you see the newsletter, there is one paper. What you should be talking to the patient. Because patient wants to know whether you want to do a PSA. So whole surgical aspect is focused on a better treatment to the patient. We are the medium through which it has been treated. So SIU is the one which has got a global end. End result is treating the patient equally all over the world. All life, every life in the world, they have a right to be treated by the best treatment. Every life, irrespective of wherever it is. And our job is to make sure that they get. So there are so many mediums through which you can do this.
And can you name in particular the benefits, for example, being a member of CIU?
SIU.
Yeah.
The biggest benefit is like in the discussion, we have a debate. Is this good or that good? We should do it, not do it. What is the complication? What is the learning curve? Is this right for the patient? So in this, we have constantly doing new ideas, innovation. But that innovation, you must have a feasibility study. Then you have a prospective randomized study. It is presented during the conference. And then it is argued. Then it is accepted. Then once it is accepted here, then you can practice all over the world. But till that time, it is only a feasibility or experimental. You cannot do experimental study on anybody without a permission, right? So, but then if it is a good idea, then if it is discussed by the people from all over the world, then it becomes an evidence-based treatment. And you need an evidence-based treatment to treat any patient. So SIU protects the patient. It does not allow any treatment to be given to any patient. You have the international consultants on diseases. In certain countries there are guidelines, which is compulsory. But when you have 124 countries, you cannot have a guideline because everywhere the end result is same. But it can be modified according to the cost it is involved. In poor country, you cannot expect them to do CT scan and everything. It is so expensive. And you do plain X-ray, minimum which is required, it is discussed. And what is the evidence? Then it is given, the evidence is given, and then recommendation is given. So if you do in that line, you are safe with the patient. Patient has right to have a proper treatment. If the proper treatment is not given, patient can go to the law and say, look, I am not treated. It's a state responsibility. It's a responsibility of society. It's a responsibility of society like us to make sure that all the doctors who are with us should have an opportunity to train themselves.
To get the knowledge.
Now, if I'm talking to you and almost 80% would be forgotten by the evening because the way of speech, the knowledge can be conveyed now, but in few hours it can be washed out. So there must be a written thing. That's why we have journals, we have the guidelines, we have the videos, we have this, where retaining power is more. But that's the knowledge. But you got to work on an animal. You got to practice. And that gives you a skill training. So knowledge acquisition and skill training, that's both we are concentrating.
And can you say more particular about Centers of Excellence for CIU? How it's possible to get there? How it's possible to get a scholarship on these centers?
Yes. Now we have, the society has accredited almost about 30 centers all over the world. So we get students apply for it. And they give a preference. And they write to the head of the institute, he accepts the person. You may not be allowed to touch the patient, but you are taught everything. if your qualification is recognized, then you get registration where you can do the surgery also. You can operate after training. But we offer 6 months training, and in 6 months we pay you $5,000 US dollar, and then hospital, like my hospital, gives the free accommodation and the free education. They are there for 6 months. We teach them. We have a more stone disease. So people who want to learn about stone disease, about percutaneous treatment or ureteroscopy, they come here. We have a laparoscopy. We have a robot. So people with a different interest, they come and they get into the program. We have a structured program. In 6 months they are taught. Then they are asked to go back and start practicing. Then they can come back again after some time, just for a month to freshen up. Or sometime, like in Africa, they invite us to their center where we organize their theater, we make them do the surgery, and then we assist them so they can start. So that's what we have done in Nigeria.
Do you provide any contacts with the government of the countries?
Yes. Yes. Well, is easier if the language is easier spoken. So I have a contract with the Nepalese government and their teaching hospital. So their last year student comes and stays with me for 6 months and learns kidney transplant. Nepal and we speak same language. Culture is same. Everything is same. So they pick up nicely. Then from Bangladesh, the people come. And then they come and learn the technique. Again, Bangladesh was a part of India before, so culture is same. So it is easier. But I also get people from Venezuela. I get a person from Germany. They come and learn because German, they don't have a stone like we have. We have a very large stone. So they come and learn the technique, how we do it. So we had a person from Venezuela. Then we had a person from Germany. We had a Belgium, Amsterdam. We had a person from England, but Indian origin. The person came. And then we had a Nepal, Bangladesh, and one girl came from Mongolia.
And do you collaborate with other urological society, AUA?
Yes, we have a combined philanthropical work with AUA and European Urology, and we have focused on Africa, and we have developed one center in Sudan and one center we are developing in Nigeria, where I had gone. And AUA is developing another center in another region. European urologists, they are developing, but we are collaborating our resources and the money.
And which way do you collaborate with Russian urologists, if you do have such a collaboration?
No, I think I know Dr. Pushkar. I don't know. So he's been our part of the many symposium which we have worked, and he works in that female urology part, and we have done that. I had one doctor who came for the stone treatment, where he had developed an impactor where he can break the stone. But he had come through one company, and then we did some trial to see whether that equipment is proper or not. So that way, but we do not have too much contact. But I know many of our Indian students, because India is a very vast country and not everybody gets into the medical college. So some of the students have gone to Russia to learn medicine, and then they come back. They appear for our entrance exam, and then they come back and practice.
And does say you want to make more collaboration with Russian urologists?
Yes, we would like SIU to be in Moscow.
Oh, great.
Because I think we have been all over the world, but we have not been to Russia. I think we would like to go to.
It's going to be a great idea to hold it.
Yes, I think when you do that, automatically amount of attention is given to this conference and the hospitals is much more. Every hospital can contact some of the specialists, call them, and then their collaboration and then do it.
Is one of the most important things.
And when it is then many people are educated, you can have a simultaneous translation because then more urologists can attend. And then we also like to know how the treatment is given in Russia and how Dr. Turov knows. He's been there. I was listening to him. But we never been to Russia. And this is a country where I think you'll have a great meeting with great attendance because people are curious and people would like to come to your beautiful country. And beside urology, they want to see the ballet and yes, and the music.
And Russian urologists, as you said, they're really curious, and so I think it's really interesting for us to get more information about the urological care in India, as you said. Can you say us how many urologists do you have and how are they certified? Should they be recertified? And what is the salary? Also,
okay. See, in India, we have a basic course where you pass MBBS, then you go for a 3-year surgery. After 3 years, you apply for the urology or cardiology or a different super specialty. So it is 6 years before you qualify as a urologist. After that, you do a fellowship, specialize in endourology or laparoscopy or female urology or pediatric urology. Like that, you do another 2 years. Then there are 2 types of practice. One is university practice, where you're a full-time salaried person. You don't get fixed salary. And then you work, but then you are academic-minded. You bring papers and things. One is private practice, where you are attached to a hospital which earn money, and you can earn good money. So in private practice, you can earn good money. In academic practice, there is a limitation, but you don't spend too much money. The house is given, the rent is given, electricity given, all the other facilities are given. You can go to the conference your hospital provides. So there is no expense and all salary. In private practice, there's lots of expense, but your earning is good. So you can travel. It is tax deducted. So on the whole, doctors are happy. Financially, they are happy.
But just for curious, for Russian, how much is salary minimum and maximum, for example, academic and private?
Well, say in academic person may be getting about per year about 600,000 rupees. That comes to about $14,000. That is in salary. Plus works, house free, rent free, car allowance.
For all doctors, housing free and...
Yeah, they have residence quarters. So the professor would have a little bigger house, a small house. But we have a campus, very nice campus. But if you are in private practice, which I was earlier, you earn from 600,000 to 10,000 per month. So you will be earning, say, there is almost 50 rupees, $1. So you will be getting $10,000-15,000 per month. But you will be spending half the money, 60% of the money. You can saving is less. So private practice you have a more money, but in academic you have a recognition. Mm-hmm. You are recognized as a professor. You produce papers. You produce ideas. So it is useful. But now we have a corporate hospital. So that hospital is built by a big houses. So that is they have all the equipment. And the salary is good, but no other problems. And we get lots of people from Africa, we get lots of people from
Walking?
Middle East. No, they come as a patient.
As a patient.
So as a health tourism is a very big thing.
And the Indian patients, do they have treatment in India or they go abroad?
Most of the time they have a treatment in India because it is available. But sometimes the very rich people, they go abroad. It's a fashion to go abroad for a treatment. But sometimes the disease is very, very complicated. And then some good center like heart surgery or a small child with multiple diseases. But we have the expertise. We have the hospitals, but there are few, not everywhere. So the people go there.
And they connect the foreign hospital through anyway through your system, through your healthcare system, or they're just looking for a hospital by themselves.
Yeah, my hospital is a private charitable, so they can come directly. It is on the internet.
Okay.
People can.
And do all people have insurance, medical insurance?
Say about our patient, which they come almost 30 to 40%. They have insurance.
By themselves or government?
No, by private company.
Private company.
Rest, our hospital is non-profit organization, so 60% is subsidized. Out of 60%, 20% is free, no charge. We don't send any patient home because they don't have money. But we have a two system again, a private practice and a government hospital where treatment is done totally free.
Okay, and private? It's
Private,
paid.
of course, you pay. So it's cash payment, so you get immediate treatment, get a priority, can get good treatment. In general hospital, you get same treatment, but there may not be a priority, there may not be a facility like 5-star hotel, like a 3-star hotel. Like that.
And for example, how much can one visit to the private practice cost for the patient?
Say about $100.
$100. Okay.
Maybe less, maybe $50 as a consulting fee, but with the investigation and all, you can get more.
In Russia, we have such a practice that, for example, for now, urologists are not allowed to do oncourology and not to do radiotherapy, chemotherapy, immunotherapy, for example, for prostate cancer. How is it in India?
Yeah.
Do you have such specialties as oncourologist, medical oncologist, or interventional radiologist?
For a urologist, we are surgeons. So if there is a prostate, we do the radical prostatectomy. We do laparoscopically, robotically, but we can do it. I'm a stone man, but basically I extended that to laparoscopy and this thing. But now we have a department which take care of uro-oncology. So in that, urologist is in charge, he's a surgeon. Mm-hmm. Then we have a medical oncologist who would treat by chemotherapy. Then we have radiation oncologists who we will not do radiation, we will not do medical. But surgical part, everything will do it.
And for example,
for that we need to have a training, and we do the training and then do it.
And for example, what about andrology, female urology,
yeah.
pediatric urology?
When I was a student, we used to do ourselves. Now we have a subspecialty. Andrologists are separate. The andrology, they do sexual medicine and the infertility. Then pediatric urology, they do children. Mm-hmm. So then female urology, they do female part of the urinary problem. Only the urinary problem. Then we have the say laparoscopic surgeon who does only pelvic laparoscopic surgery, and some does the kidney surgery. So there is a place for all specialization. So that is one which is getting popular now. I think in years to come, what is our aim is every life deserves a world-class care. So one person cannot do everything.
Yeah.
For earning, yes. But quality-wise, no. So you got to qualify into something, give your mind to that specialty, and then go into the depth and give them the best treatment available.
And how many residents do you have? Do you have the precise number of residents that are going each year?
Yes. We have 4 residents per year, and
in
that's
your hospital?
in my hospital. Per for 3 years, means 4, 4, 4. So 12 resident, then 2 fellows, so it is 14. 1 SIU fellow, so that 15, and then observers, 6, 7 observers are there who come and.
You know the general number in India, how many residents in all hospitals? Is it?
We have now more than 120, 130.
But it's a precise number for each hospital.
See, for a teacher, you can have a 2 per teacher. So there is a restriction. That's why once people get qualified and they don't get into this, the more people qualify to become a specialist, then they migrate to United States or UK, and then they get specialization, then they come back. When I was a student, there was only 2 institutes which offered urology training in India. That was 1967. I went to England for 5 years, trained in urology, I come back. Now there are about more than 100 department which offers the urological training.
And who certificate these centers?
There is a central board of examination is one, and second is Medical Council of India. It's a regulatory body. It decides the hospital qualification, ensures that you are getting the proper education, and then they take the exams, and the examiners are outsider, so they properly do it. While a central board of examination, the exam is conducted in one place or 2 places in the whole country, and where we get qualified. So that's quite tough to get qualified.
And does Indian Urological Association take part in this process?
Not Urological Society of India doesn't take part into this function, but it does influence the quality and the thing. If there is something wrong, they will make a lobby and they'll make an issue. It will be discussed. Urological Society is the society of the urologists. So whatever issue which is concerns them, but they also conduct postgraduate training programs and mock examination. So they prepare the students for the examination.
Okay, and do you have just one Indian Urological Society? For example, in Russia we have Pediatric Urology Society, Onco-Urology Society, Andrology Society. Do you have different societies, or just one organization with different sections, such, for example?
No, we have one society with different sections. Yeah.
And they're all under one umbrella?
One umbrella. Yeah. And thus we have one society, but it has 4 zones, north, east, south and west. And each zone also conducts its own training program. And then USI is a central, it meets once in a year. So all to collaborate, because it is difficult. It is a country of 1 billion people. So it's difficult to manage. So you have to divide into a different class. And each zone has a different states. And each state has a different small society. And each state has a different towns. And each town will have a small society. So everybody conducts a teaching program all around the year. So if you see number of teaching program, plenty. You can.
It's really nice. When it's well structured, it's better, because in Russia it's different structured and they sometimes conquer with other and difficult to collaborate.
Yeah.
I think it's the great thing.
It's very competitive.
Yes, competitive.
Very competitive.
And as far as I understand, you've never been to Russia?
I would love to come to Russia. I've never been to Russia.